Welcome to Doctors on Call. I'm Jenna Miller. Nearly 1 in 3 adults and 46% of young adults had either a substance use disorder or a mental illness in the past year. The median age of onset for substance use disorders is 15 years old, meaning half of individuals with substance use disorder will experience symptoms by the age of 15. How can you help a loved one who may be in crisis? We'll find out more tonight as we speak with Cary Schwartz, Amy Bird, Cindy Pfeifer, and Tara Rollins from High Plains Mental Health Center.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Regional Hospital, experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Welcome back to Doctors on Call. Tonight we're discussing substance use disorders. Cary Schwartz is a senior outpatient clinical supervisor who provides outpatient therapy services in Hays and Plainville. She has been the lead clinician of High Plains Mental Health Center's substance use treatment program since 2016. Amy Bird is an outpatient therapist in the Hays main office. Amy has many years of experience providing clinical therapy for adult clients with special focus on trauma and substance use challenges. Amy is a member of the Ellis County Recovery Court. Cindy Pfeifer is the Assistant Director of Medical Services at High Plains Mental Health Center and helps oversee psychiatric services. Cindy has many years of experience in the healthcare industry. Cindy helps manage High Plains Mental Health Center's medication-assisted treatment program for opioid and alcohol use disorders. And finally, Tara Rollins is a certified peer mentor for substance use disorder services, working to help clients achieve recovery and maintain sobriety. She is also a member of the Ellis County Recovery Court and an active volunteer with Oxford House Facilities in Western Kansas. Our show brings you information which may be useful to you when you see your own physician or therapist. Thank you all so much for joining us. We appreciate you coming out, and we're going to get started with some questions before we wait for those calls to come in. First of all, can you explain what a substance use disorder is?
Sure. So what we really try to get people to understand is it's a mental health condition that tends to lead toward brain and behavior problems, and also not being able to control the amount of substance that is used, and really struggle with fulfilling major life obligations.
Sure, and we were talking in the open that the median onset is 15 years old. Let's talk about that. What's going on?
Yeah, it kind of makes us a little bit nervous when we see those kind of stats too. So we know that there are a lot of pre-risk factors, and trauma would be one of those. And I know all of us at High Plains try to do trauma-informed trainings so that we can recognize those kind of things and catch these, when they're early and hopefully more treatable.
Sure, absolutely. And how common are these disorders?
Substance use disorders are very common. As you said in the beginning, 1 in 3 adults has either a substance use disorder or a mental health challenge. About 13.5% of young adults, 18 to 25, have a substance use challenge. It's also very common for people to have co-occurring disorders where they have a substance use disorder and a mental health challenge.
Sure, and what do you do for those patients that come in needing help?
Ideally, we try to integrate treatment and treat both conditions at the same time rather than separating the treatment because they impact each other so much.
Sure, absolutely. And sometimes there, unfortunately, tends to be a stigma attached to mental health illness. Is substance addiction really an illness?
It is. It's classified in the Diagnostic and Statistical Manual as a mental health challenge. The American Medical Association classifies it as a mental health challenge, and so it is a treatable disorder and something that we focus on helping people with.
Sure. And what are we doing? What are we doing wrong, maybe, that we're not getting past that stigma?
Well, I think it's just, before, and I can't remember what year we were talking as we were, thinking about what we would like to give to the people out here. There was a time in recent history where addiction wasn't even considered a mental health condition. So I think we have come a long way in trying to classify it where it needs to be classified so that it can be treated. And that's what's nice about hopefully what we're going to get to,
Sure.
The programs that we offer at High Plains to try to get it from as many sides as we can, as early as we can.
Absolutely. And can you tell us a little bit about the connection between mental health and substance use challenges?
I think a lot of the time what we see is, you can't really say that one necessarily causes the other, but I think what we see quite a bit of is somebody who's struggling with a mental health problem or challenge will oftentimes use substances to feel better. When we don't feel well, we want something to help us to feel better, and we want to feel better right away. And so substances are readily available, and it's something that people often turn to. I think part of that may have to do with the stigma of even, getting mental health treatment. It's getting better, but it's still not, where we want it to be, that people feel free and open to come in and let people know, hey, I'm getting help for this.
Sure. And speaking on that, do you find that sometimes clients come in or don't come in because they are trying to self-medicate themselves without getting the help that they need?
Sure, and I think again a lot of that has to do with stigma, also just being able to be ready to admit to themselves that I have a problem and I need some help with that.
Sure, sure. Okay, I'd like to speak a little bit more in depth about the individual services that you were talking about that you all offer for your clients. Let's start with Cindy. Can you tell us a little bit about the medication-assisted treatment?
Yeah, it is an evidence-based treatment for clients that focuses on certain opioid use disorders. And so what it does is it has a combination of medication along with the counseling and behavioral therapy. And those medications can help reduce the early symptoms of withdrawal that the patients experience when they're trying to come off of the opioids. And it increases their survival rate, and it's a form of maintenance treatment, and it helps prevent substance use, the opioid overdose.
Sure. And how much time are we talking to get them off one or on one to get off another?
So they would come into treatment, and we would get them an assessment done, and then we would start right away with, we have two medications that High Plains Mental Health Center's psychiatrist prescribes, and it's called Suboxone, which is buprenorphine and naloxone, and then the other one is just buprenorphine alone. And what it does is help kind of calms the brain chemistry, it helps with reducing those cravings, and it kind of calms things down. So patients can then handle the withdrawal symptoms as they have withdrawn from their opioid use. And so it's just a safer way to withdraw from those medications.
Absolutely. We mentioned a little bit about an evaluation. I might talk about that in a minute, but right now we've got a caller waiting to ask a question. So we're going to go to the phone lines right now. This is Mally on the line from Pratt. Hi, Mally. Go ahead with your question for our therapist tonight.
Yes, I was wondering if High Plains offers any faith-based psychiatric counseling from a Christian therapist.
So, yeah, great question, Mally. What we do is we hire really good therapists, and we kind of give them the ability to do trainings, to become kind of an expert in some of the areas that are of interest to them. So we don't hire somebody and say you have to be either faith-based or not faith-based, but we offer the opportunity for therapists to go that direction, and we do have some that enjoy that.
Sure.
Yeah.
Now, speaking on that, do you ever have a client that comes in that specifically says, I would like this kind of therapist?
Absolutely. And we love it when people say, I feel like I'm going to get the best treatment if I get, somebody who understands this. So we enjoy being able to give them some of their preferences. Yeah.
Absolutely. Okay,
Yeah.
very interesting. Hopefully that answers Mally's question. So we were talking, you had mentioned, Cindy, about the evaluation. So explain what a client can expect when they come into the office for help.
Right. When they come into the office for help, we are getting them set up with a therapist, with the psychiatrist that treats the opioid addiction, if that's what they're coming in for. And then we're doing an assessment, substance use assessment. So that is kind of the process, and we're getting them set up with the psychiatrist right away so we can start talking about a plan for them.
Sure, and how effective is this type of treatment you were talking about, and how can clients access these services?
So it's very effective. What we've found is patients are staying in treatment longer, so they're maintaining and gaining employment and being able to function out in the communities, engage with their families, engage with their communities more, getting back in their churches. They're reducing that risk of having an opioid overdose, and they're actually just maintaining that support. You know, they're also, sometimes we're seeing their level of criminal justice interactions have lessened, so they're just maintaining. We've got some right now that's been in treatment for 2 years, and they're doing very well.
That's wonderful to hear. Now, Amy and Tara, can you tell us, we had talked in the open about the Ellis County Recovery Court. Can you explain a little bit what that is?
Yes, so the Ellis County Recovery Court program is the goal of that program is to combat substance use addiction as an alternative to jail or prison.
Okay, sure. So it's a fairly new program, from what I understand. How are things going, and what's your goal right now for this program?
Our program started in 2018 here in Ellis County. I joined in 2020, and I believe Tara joined in 2023, 2022.
Yes, I'm sorry.
So prior to us being on the team, they didn't have the mental health component. The team consists of our judge, who currently is Judge Brown. We have law enforcement. We have community corrections officers, a county attorney, and then there's a defense attorney. And so we work with the participants in the program. Anytime we have 20 to 25 people in the program, it's about average. And so, I forgot to mention also, we have substance use providers from Smoky Hill Foundation, who also provide services. And so we're trying to address all of the needs of that person to help them through recovery, and like Tara said, to be able to stay out of jails and prisons and to get back into living healthy, satisfying lives.
Sure, absolutely. Sounds wonderful. Now, Cindy, you had mentioned that you have some that have been in a couple of years and they're doing fantastic. What happens, or at what point, if somebody is not making progress, what do you do?
We just meet them where they're at. So if they're just needing a break, we can let them have a break, and then we'll restart back up again. It's really based on that conversation between the therapist, the psychiatrist, and the patient. So we just meet you where you're at.
Okay. All right. Okay, Tara, can you help us understand a little bit more about what a peer support mentor does?
Yes, so as a peer mentor, I am a person in long-term recovery who is trained to help support other individuals who are seeking to achieve recovery themselves. What that kind of looks like for me is community-based. So instead of them coming to the office to me, I meet them where they're at physically and emotionally. And I help them get connected with community resources. I introduce them to recovery meetings in the area. Sometimes I attend them with them. That way they can feel supported in making or networking with other individuals who are also in recovery. Even little things like creating a calendar for the month so their life is a little bit more organized, or setting a financial budget.
Sure. Now, how are your services different from, let's say, clinical therapy?
My services are different because, well, I'm not clinical per se. So I'm not licensed, I'm not a licensed therapist, I'm not a licensed counselor, and I'm definitely not a replacement for professional mental health services or professional addiction treatment. I'm just one supplement component that has proven to be beneficial to work in the whole network of treatment. So.
Okay. Now, Cary, can you talk a little bit about the clinical therapy services that may be effective for substance use disorder challenges?
Yes, and I like that Cindy kind of explained already, the assessment to get into services.
Sure.
And that's one of our first steps usually is, we identify, with the client, so what all services are going to be good for you. So therapy is one of the very first ones that is offered, and it's individual based, and we also have some group therapy for people who will benefit from being with their peers, in a group as well. Yeah, so we focus on, usually it's cognitive behavioral therapy, dialectical behavior therapy. Those are some of the therapies that we use.
Sure. So how commonly, we talked about this a little bit, but I'd like to dive a little deeper into substance use co-occurring with the mental health challenges or in clients with history of trauma. How do you handle that? Or how common does it happen?
Well, I think for an example, if we look at our recovery court, we currently have 20 participants in the recovery court. Out of those 20 participants, 18 of them are also in mental health services with High Plains Mental Health Center. So I think that is a good demonstration of how common co-occurring disorders are.
So let's talk about the types of services that some of the other services that High Plains Mental Health Center offers for clients, for both youth and adults.
So certainly we've talked about the therapy and the individual, and we also have multiple groups, not just regarding the substance use treatment. We also have groups that are, people of any kind of, need for treatment can enjoy, including things like boundaries and self-care. Self-compassion is one that I think a lot of people have really enjoyed. Yeah. And then we also have our medication services, not just the MAT program that is specific for substance use. So I will let Cindy take that away some more about the other.
Yeah, we provide medication for depression, anxiety, ADHD, children. We see all ages, 2 on up. So we are here to support and provide some guidance on what medication fits best for you.
Sure. Earlier in the season, we were speaking with a couple of doctors specifically about depression and some of the things that they help their patients with. Let's just talk a little bit about, they touched on how important it is to get someone if they're in a really, really low point and, considering taking their own lives, how important it is to get them through that moment in time. Let's talk about more what you guys can do to help.
Absolutely. So, that's one of the things that has been just long history with High Plains, is being able to provide services 24 hours a day, 7 days a week. So we have, of course, our office hours, if you will, that include late evening hours for people who are not going to be able to get off work, or traveling is a little bit of an issue. So we have daytime services, and then we also have the after hours crisis services, that are pretty exciting because we are just building what's called a mobile crisis response team. So it used to be, that if you had a crisis, you were probably going to talk to somebody just on the phone or just on a Zoom, say, meeting. And now we're expanding into trying to also sometimes be able to meet people out in the communities and prevent, being sent to an inpatient unit or something like that. So. Yeah.
Sure, that's very interesting. Yeah. And so the Mobile Crisis Response Team, this is a new thing?
This is a new thing.
Okay, let's talk a little bit more about it then.
Okay. So this is part of a grant called the CCBHC. That's something that we just started about 3 years ago, almost. We're almost there. So it is just building anything that we can do to meet people in the communities where we serve. So yeah, the Mobile Crisis Response Team is, like we said, it consists of some therapists and some peer workers like Tara, and then also some case managers that we haven't touched on yet, that are also community-based workers and accustomed to helping people out where they're at. So, we are going to be trying to help those people who call in and say, I need this help, or somebody that loves them, or somebody in the community like a law enforcement officer has been called on the scene and realizes this is important, a doctor in an emergency room or a doctor's office, are going to be able to access this. And we're hoping to reduce the amount of people that end up having to go away from their homes to get treatment. Yeah.
Okay, excellent. All right, we're going to go back to the phone lines. We've got a caller from Wichita waiting to ask a question. Go ahead with your question for our guest tonight.
I was wondering, are you guys located in Wichita?
No. Our main office is in Hayes, Kansas. I kind of chuckle with people and I say, if you want to see where our catchment area is for High Plains Mental Health Center, it's the address label of Kansas. Sure. Yeah. So ComCare would be one of the options that you would have in Wichita that would be similar to what our services are.
Okay, all right. And they can just, I'm assuming, Google that and find out the information. Wonderful. Yes. That was a great question. All right, so let's talk about youth and how youth seek treatment for substance use disorders.
So this is kind of interesting because typically, you think somebody who is a legal adult at age 18 is going to be the one that says, okay, I'm ready to go to services, I'm going to sign my name and sign all the financial forms and everything to be able to access services. When it comes to the substance use services, it's historically been something that they wanted to open up to catch, I think, sooner. So kids as young as 14 can actually go in and sign themselves in for treatment. And they'll still have to maybe sign releases to be able to have their parents help out if there's an insurance plan or something like that that needs to be billed. But we welcome youths to come in with their families or if they want to on their own.
Sure. And you might talk a little bit more about the policy, that policy for parent guardian consent and involvement. I don't know who wants to take that one.
Do you know it very well? Yeah. So, if they call and if a youth calls and says, I really want to get into services, I don't want to wait for my parents, for instance. We would prefer, of course, that there's family involvement, but we understand sometimes that can be complicated. So they would just call our regular number, 785-628-2871, and say, I'm ready to start services, and we will have somebody kind of walk them through the paperwork and the documents and, helping them kind of understand what their options are as far as giving consent, even if it is limited consent just for the purpose of the financial piece of it. But we also have like sliding scale options for people who need to help affording services.
Okay. We've got Sylvia back on the line from Wichita.
Okay.
She must not have gotten the rest of her question in. So go ahead, Sylvia. We are ready to take your question now.
Yes, I was just wondering, my son is in the hospital at St. Joseph's, and he's having problem with bipolar, anxiety, grieving, a little thing of everything. And I wanted to get care, but we did call ComCare, and they did come out to the house to try to assess him, but he wasn't cooperative with them, so they said there's nothing they can do.
Really complicated. Adults have, the ability to have the ability to consent for treatment. And that can be one of the most difficult and challenging parts for family members if they see somebody is struggling and want them to get help, but the individual maybe isn't ready or says they don't want services. Unless legally in Kansas, unless a person is in an imminent danger to themselves or somebody else, we can't force somebody or court order somebody into treatment or services. But that's a really good question, and sounds like families really struggling, and I always encourage families to reach out for their own help and support, either through a mental health center. There's also in Kansas the National Alliance for Mental Illness, NAMI, is a really good resource for families to get education. They have support groups, and so I would encourage you to contact somebody from, there are probably several NAMI chapters in Wichita and all throughout Kansas.
I was just going to ask because I'm sure they're focused on her son, but Sylvia needs to take care of herself as well.
Absolutely, yes. Absolutely.
Okay, well, we want to thank all of you for coming and being our guests tonight on Doctors on Call. Our thanks goes out to Cary Schwartz, Amy Bird, Cindy Pfeifer, and Tara Rollins from High Plains Mental Health Center for being our guests tonight on Doctors on Call. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.